everyone. My name is Rachel, and I'm an ambassador for the Setting Scoliosis Straight Foundation. I myself was a scoliosis patient and had spinal fusion surgery in 2015, and now I'm studying bioengineering at UC San Diego in hopes of also becoming a physician in the future. And today I'm here with Dr. Stephen Wong, and I'll be asking him a few questions about his research. So do you want to tell us a little bit about yourself?
Sure, thank you, Rachel. My name is Steve Wong. I'm a neurosurgeon by training, specializing in deformity surgery, involved in the Harm Study Group, and I work in Philadelphia primarily right now at Shriners, Philadelphia.
Awesome. Well, thank you so much for being here.
Thank you. Thanks for having me.
Yeah. So I wanted to ask a little bit about your abstract. In adolescent idiopathic scoliosis, do all instrumentation-related complications require revision surgery? So you presented this abstract last year, and I wanted to see if you could tell us a little bit about the abstract and why you decided to focus on this topic of research.
Sure. I think our study group is great because it allows us to pool a lot of patients from a lot of different centers and people specializing in scoliosis care. So it's a unique opportunity to really tackle questions that we don't have answers to. And so in this particular question, we're looking at instrumentation problems. So after screws and rods going classically to correct the scoliosis, even 5 or 10 years later, what happens if there's a break or something pulls out? My classic teaching was, when I was training, was if there's a break, you got to go fix it, to revise it. And we started looking at it, we realized about half of the instrumentation breaks and failures actually did not need revision. And that some of the biggest factors were patients complaining of pain or had complaints, symptoms of it, then they were more likely to have surgery to revise it. But I think it's helpful for us as surgeons to know that not every patient that has a break in the rod or something needs to undergo more surgery, and that many of those patients for several years out will still do just as well if you observe them, as long as they're not symptomatic.
I see, yeah. So how do you think the results from your investigation will improve care for patients with scoliosis?
So I hope it helps basically enlighten a little bit the surgeons and the patients about things that could happen, so the risk of it happening, and that, again, not everyone needs to undergo another surgery, so hopefully more surgeons will feel comfortable watching those patients if they're asymptomatic, and hopefully change care a little bit in that way.
Awesome, yeah. And then I just have one last question for you, and that's just, what is your, favorite part about being a surgeon working with these patients?
So I think it's definitely interacting with the patients themselves. I'm sure you have a great relationship with your surgeon as well. And I think having an impact and helping people is really what's most gratifying and what I like the most about it. But I think that's a unique opportunity to have an impact in somebody's life and hopefully feel better and really, contribute kind of thing. So that's what I like about it overall.
Yeah. All right. Well, thank you on behalf of your patients for all that you do for them to help them. And thank you so much for your time today.
No, thank you very much. It's been a pleasure.